Hello, I am Lester the Lifeguard. Welcome one and all to the YAI family. I will be your tour guide in navigating the realm of HIPAA. Together, we are going to look at concepts in the exciting world of protected health information, PHI for short. Why am I creepily whispering to you? I don't know. I thought it would be funny. Clearly, I was wrong. Please sit back, get comfy. Not too comfy. You in the back. I see you. Don't think I don't. And enjoy learning about this vital information about protected health information, which will also teach you something about your own rights.
HIPAA stands for the federal law entitled the Health Insurance Portability and Accountability Act, which was passed in 1996. The federal law covers all health plans, healthcare providers, and business associates. As a healthcare organization, YAI is subject to HIPAA regulations. The function of HIPAA to protect the privacy and security of protected health information, PHI. It is the responsibility of all staff, volunteers, and board members to protect the privacy and security of PHI.
Hold it!
Yes, Lester?
Can we define what makes up PHI? I mean, if we're going to talk to people you know about these acronyms,
Lester.
in the least, we have
Lester.
to really make it clear, you know.
Lester.
Huh?
I was just getting to that.
Well, good. Go on then.
Protected health information, or PHI, is any information that can identify a person, including a person's name, address, date of birth, social security number, health diagnosis, services received, photographs, or any information contained but not limited to a person's medical records, insurance records, payments, billing records, treatment records, health records of any kind used to treat the people we support.
Okay, so now we know what PHI is. Can you please explain to these fine folks what we mean by privacy and security?
Privacy refers to safeguarding PHI kept on paper records, information sent or received by fax, or simply keeping people from overhearing PHI, say in an elevator. As mentioned before, photographs are considered PHI and should never be shared without permission. Please remember not to discuss PHI in public areas. Only copy and use PHI that is consistent with your job function. Do not provide access to copies of PHI to other staff members who have not been given permission to view the information. For general safety reasons, always wear your YAI ID. For those of you that work in an office or clinical setting, make sure to keep all potential PHI locked in cabinets and offices. Don't leave any PHI on conference tables or on your desk, or especially at the printer. Pick up your work as soon as possible.
Let's take a look at what we mean by all of this.
Good afternoon. Skin and Bones Medical Center will be here just enough to keep you breathing. How may I help you? Oh, I can't give out that information, sir. Oh, you're his cousin's neighbor's best friend's dog walker. Why didn't you say so? Yes, he's been being treated for... Yes, he said he fell into a pile of poison ivy leaves. Your guess is as good as mine. I just don't understand why he had his pants off. Yes, poison ivy is no laughing matter, especially since he got it all over his
pizza, anyone?
Okay, listen. That last scenario was an obvious, ridiculous exaggeration of a HIPAA breach. More on this later. But I can assure you it's no laughing matter. I will share another situation which is more common than you might think.
Are you the family of James Smith? James Smith's family? Yeah. I am very sorry to inform you, but based on the tests we have run, I'm sorry to say it is not good news. The test results say that the infection is spread. I'm definitely going to have to operate, remove both the legs, oh yeah, above the knees. And I don't know about the prognosis because your uncle is 87 years old, so I don't know. But legs have got to go.
The security rule defines the standards that require covered entities to put in place basic safeguards to protect electronic protected health information, EPHI. EPHI is computer-based health information that is used, created, stored, received, or transmitted using any kind of electronic information resource. Some key principles of security are confidentiality, meaning that data or information is not available or disclosed without permission. Integrity. Data or information has not been altered or destroyed in an unauthorized manner. Availability. Data or information is accessible and usable upon demand only by an authorized individual. How we keep EPHI safe? You are required to assign a security officer who is responsible for the development, implementation, and oversight of YAI security policies and procedures in relation to PHI stored in electronic form. Use strong passwords.
Please don't write them on a Post-it near your desk. I know IT asks you to change passwords all of the time, but don't just announce your password of 12345 on the desk. By the way, this password is no bueno. Use a mix of capital letters, symbols, and numbers to secure your login information.
Log off or lock your computer when you leave your desk. Always save files to the shared network drives, OneDrive, not the local hard drive or desktop. The use of flash drives is strictly prohibited. Use flash drives only as directed and in compliance with your IT policy. Do not send, forward, or reply to emails from people or external entities you don't know. Be aware of malicious emails that may contain viruses, worms, or other potentially disruptive software. Please do not stare and look over at coworkers' workstations. They may be working with PHI that you do not have permission to see. Report lost or stolen devices immediately.
This means immediately. Don't look for it, then report it a week later. If you suspect your device is lost, report it to the organization's security officer right away.
Any type of computer equipment that is no longer needed, for example laptops, computers, disks, CDs, should be disposed of by IT. Emails about people receiving any services should only be shared with those who have a need to know this information, and only in connection with their specific job responsibilities. Keeping EPHI secure. Email. Emails sent within YAI are automatically encrypted. Any emails containing PHI sent to an external provider, state organization, family, or to anyone without YAI.org email address must be encrypted before being sent using the approved organization procedure, regardless of whether the recipient reports that they are unable to view the encrypted email. Please make sure to follow your organization's policy on securing emails containing EPHI. Do not use personal email accounts for organization business, ever.
I know you love your personal email. hotlips.in@hotmail.net, but you can't send any PHI through your email address. Oh, and by the way, let's talk about social media.
Only use social media at work in accordance with your job responsibilities and your organization's policy. Do not transmit photos or data via text messages or post anything to social media sites.
They really went all out with the budget this year.
Yeah, we got 2 pizzas this year. Yeah.
It's way better than last year.
Yeah.
Better than 2 slices, right?
Yeah, it was tough. We kind of fought over that. Hey, good to see you. Yeah, you should get some pizza. It's almost gone.
2 pizzas?
Yeah.
Could I have a drink?
You know, I need to take a selfie to commemorate this occasion. Sure. All right, everyone. Get close. All right. #influencer.
Even though you may be an influencer, please note that photographs are covered under HIPAA and thusly cannot be taken with your personal phones. The organization has a social media policy which protects the privacy of people we support. Even at a fun get-together, staff providing services should never, ever take pictures with personal devices.
If you want to document something in your program, make sure you have signed media release /HIPAA authorization forms for each of the people we support that are in the picture/video. Use an agency-designated device to take the picture or video. Make sure to send this content to communications@yai.org. Some organizations may designate cameras or tablets to capture events for publicity or marketing. Remember, photos and videos are covered under HIPAA, and organizations must obtain written authorization by the people receiving services. In most instances, in order to disclose any PHI to a third party, a HIPAA authorization form with all information required by the law must be signed by the person whose information is being shared. However, there are certain circumstances when a signed authorization is not needed. To help explain this, let's think of a stoplight.
Oh, another animated mascot. Hey, I was here first. Ahem. This is Traffy. Remember him when you must send PHI.
Traffy? Seriously? Is that the best they could come up with? Oh, PHI may only be used or disclosed without prior authorization for purposes of the organization's treatment activities, payment activities, and healthcare operations. That's TPO, treatment, payment, and operations. This would be a green light situation. Treatment involves providing, coordinating, or managing the individual's healthcare and any related services, such as a hospital social worker sending a referral over a patient to a rehab facility. Payment means activities undertaken to obtain or provide reimbursement for the provision of healthcare, such as a healthcare provider submitting a claim to Medicaid or any insurance company. Healthcare operations are general business and administrative functions that are required in order to deliver healthcare services, such as audits by federal, state, and local authorities. Certain PHI comes with greater protections, such as information related to HIV, mental health, and substance abuse, and an authorization may be required even for TPO purposes. Please make sure to check with your state and local authorities, as these restrictions may be stricter than the federal guidelines, therefore superseding the federal restrictions. This is definitely a red light situation. Before you can release this more sensitive PHI, you need to stop and check to see if we have or can get an authorization first. Then there are instances where you might be unsure whether or not an authorization is needed. This is a yellow light. Slow down and ask your supervisor or the privacy officer if you are unsure whether a particular use or disclosure of PHI satisfies the definition of TPO. And remember, when disclosing any information, the minimum necessary standard applies. This means you should only disclose the information requested and nothing more, even internally.
Please also know that each person receiving services is required to receive a notice of privacy practices, which spells out how the organization will ensure and protect the person's PHI always. Like, forever.
What happens if PHI is disclosed without authorization? A breach is defined as the acquisition, access, use, or other disclosure of unsecured PHI in a manner not otherwise permitted under HIPAA, and which compromises the privacy or security of the PHI. Potential breaches can be one of two types: privacy or security. Examples of a potential privacy breach: a service documentation form containing PHI cannot be found within the residence or facility. A fax with PHI is sent to the wrong fax number. PHI put in interoffice mail does not reach its destination and cannot be found. PHI mailed to the wrong recipient. A workforce member talks about the PHI of a person in an unsecured and private location. Examples of a potential security breach. A staff member sends an email containing PHI to an outside organization without using the approved encryption method. A staff member shares her password with another staff member or logs into YAI computer system, then allows someone else to access restricted data that they would have not otherwise have access to, logging on to an unsecured network while accessing PHI. A lost or stolen device containing electronic PHI, such as a lost smartphone or laptop. Any staff member who knows, believes, or suspects that a privacy or security breach of PHI has occurred must immediately inform their immediate supervisor, the privacy officer, or the security officer.
Let's look at these two scenarios to see examples of possible breaches. Geez, you are a springy little bugger. You're not in this section. Shoo! Shoo!
Jane, have you seen Mitchell's file?
Last time I saw it, it was in the file room.
I can't find it anywhere, and there's some papers that I need to file.
I'm sorry, I haven't seen it.
Hi, John. I can't find Mitchell's file, and I gotta take care of these important documents.
I gotta let the privacy officer know about this.
Is it that serious that we gotta contact the privacy officer? I mean, it's gotta be here somewhere.
Maybe, but we really don't know that for sure. I'll let the privacy officer know that it's missing and that we will continue to look for it. In the meantime, see if you can find out who took the file last and we can start from there.
We got the file.
Great. Where was it?
It was stuck in between the shelves at the bottom of the rack.
Great. I'll let the privacy officer know. No harm done today.
What type of potential breach is this? This is an example of a potential privacy breach. As the supervisor mentioned, it is imperative to contact your privacy officer immediately. You can continue to look for the item after you report it. For privacy breaches, remember, paper documents, spoken word, contact the privacy officer.
Sure. There you go. What'll it be?
Coffee, please.
Okay. All right, I've got a supercalifragilistic half-calf double shot macchiato for Bill. There you go. Careful.
Yes.
Oh, good. Glad to hear it. Yeah.
Oh, holy sh**. That is hot. That is hot.
Wow. How do you manage to get poison ivy on your
Peter, I have a triple foam espresso for you.
Can you believe this guy?
What type of potential breach is this? This is an example of a potential security breach.
Seriously. This was very, very bad. Geez, this guy's a huge liability. It might be easier to point out what he did right, which is basically nothing. Probably only how creative his coffee choice is.
For security breaches, remember electronically, must be reported immediately to the security officer. We'll share your security and privacy officer's contact information at the end of the training.
So, there you have it, folks. I hope you have walked away from this training with a greater understanding of HIPAA. Until next time, for further information or to report a potential breach, be sure to contact YAI security or privacy officers.